And the third case was this young man with the bigeminated central incisor. And as I said, after much discussion, the eventual treatment plan between the orthodontist, myself, and the prosthodontist was that we'd recommend extraction and implant placement. Now, of course, in a case like this where orthodontic treatment would need to begin and go over a period of perhaps 18 months to 2 years, if you simply took this tooth out and did nothing, then of course you'd be facing significant resorption of the ridge. And this case was very interesting from a learning perspective for me as well, and I'll point this out at the same time. So the treatment plan was type 4C, late placement following socket grafting and completion of orthodontic treatment, followed by a conventional loading protocol. This young man was age 19 at the time. So we then take out the tooth, and the extraction was not a simple extraction because, of course, rotational forces become very difficult with a case like this. But eventually, the tooth was able to be delivered without damage to the bone walls. And then, as per the socket grafting techniques, this is DBBM in a collagen matrix was then grafted into the socket, and then a piece of collagen used over the top to seal that in. Okay, so you can see that, and then there's the initial healing. So our young gentleman goes off and gets the orthodontic treatment started, and comes back to see me after completion of orthodontic treatment. So this is 18 months now after extraction and after the orthodontic treatment has been completed. And I think what's very instructive is the occlusal view, which is that image on the right-hand side. You can see that despite the grafting into the socket, we've still had quite significant flattening of the ridge. And you must remember that the socket grafts don't preserve the ridge. They just limit the amount of resorption that takes place. Resorption will still take place. And to show you the extent of the change that's taken place, if you go back to the original extraction and socket graft, you can see quite clearly there's been quite a lot of change. Of course, the graft has retained enough bone for an implant to be placed and forms a good base for an additional GBR procedure for further contour augmentation. And I think what's really instructive is the intraoperative views. So you can see the preservation of the bone in the apical region. This is the image on the left-hand side. You can see that doming of the socket. That's where the socket was, and that's where the graft has really settled in very nicely. But you'll also see, if you look very carefully, that the surface of the bone is irregular. It's irregular because that's now the DBBM particles showing through. The original facial bone is no longer there. That's been resorbed through a remodeling process. So, and that's a real eye-opener because we think about the facial bone resorption in the crestal region, but it's quite likely that it's the whole facial bone plate over a period of time after resorption and modeling that also disappears. So almost your entire facial bone on your implant then becomes the biomaterial. Now, going on, the implant was then placed, and the implant had to be placed slightly different to where the original socket was, with an intentional apical fenestration. But then the normal GBR procedures can be undertaken to eventually allow the implant to be placed and the graft to be completed. So there's just the clinical images, and here's the patient after 12 months. It's a good result. It's not a great result, of course, because we have some soft tissue anomalies. But I think under the circumstances, given the size of the tooth and the deficiency, then I'm quite satisfied with this outcome.